The broken handstand versus the straight handstand. The handstand is regarded to be one of the most important fundamental skills in a sport like gymnastics. It is considered to be extensively demanding and rigorous of a postural stance when compared to an upright bipedal stance or normal standing posture. The degree of stability of a normal standing posture identifies the following factors: 1. Center of gravity, 2. Base of support, and 3. Line of gravity. The center of gravity is a theoretical point around which the mass of an object is balanced. It is around this center that gravity acts. Changes in the position of a body influences the position of the COG. The base of support is an area within the body's point of contact and any object the individual relies on for support. The larger the base of support, the more stable a body or an object is. And the line of gravity. This is a line of force indicating direction of gravity. A body is stable when the LOG runs through the center of its base of support. There are 4 specific factors to which an upright body depends on for stability. These are your height of the center of gravity that is above the base of support, your size of the base of support, the location of the line of gravity within the base of support, and lastly is the weight of the body. So when compared to the upright body, the handstand as considered to be extensively demanding and rigorous had the following existing factors that influence stability. 1 is that it has a smaller base of support. 2, an increased distance between the center of gravity and the support surface. 3, that it requires unusual muscle activity from the upper limbs for a beginner or anyone who has not trained hand balancing or inverted hand support. 4, that function of the upper limb muscles is more precise and less fatigue resistant than the lower limb function. 5, that the anteroposterior deviations are greater. And 6, that the body configuration for the handstand requires specific postural control from 4 joints, your wrist, elbow, shoulder, and hips, as opposed to 3 for the bipedal stance. Now let us consider the muscles involved when performing a handstand. In an ideal erect posture, body segments are aligned so that the torques and the stress on the body segments are minimized and standing can be maintained with a minimal amount of energy expenditure. Now, the location of the line of gravity shifts continually because of the postural sway. As a result of the continuous motion of your line of gravity, the moments acting around the joints are continually changing. So when the line of gravity passes directly through a joint axis, no external gravitational torque is created around the joint. However, if the line of gravity passes at a distance from the axis, an external gravitational moment is created. Now, this moment will cause rotation of the superimposed body segments around that joint axis unless it is opposed by a counterbalancing internal moment, that is, a muscle contraction. The magnitude of gravitational moment of force increases as the distance between the line of gravity and the joint axis increases. The direction of this external gravitational moment of force depends on the location of the line of gravity in relation to a particular joint axis. So if the line of gravity is located anterior to a particular joint axis, the gravitational moment will tend to cause anterior motion of the proximal segment of the body supported by the joint axis. And if the line of gravity is posterior to the joint axis, the moment will tend to cause motion of the proximal segment in a posterior direction. So motion of a particular joint axis created by this external gravitational moment will be opposed by what we call an internal moment. And this is of equal magnitude for it to establish equilibrium. In a straight handstand, the line of gravity is located posterior to the wrist joint, which creates an external gravitational moment into extension. This will be opposed by the flexor muscles of the wrist joint. It is slightly posterior to the elbow joint, leading to an extensor moment and to be opposed by the flexor of the elbow joint. It is slightly anterior to the shoulder joint, creating a flexor moment and to be opposed by the extensors of the shoulder. It is slightly posterior to the hip joint, creating an extensor moment and to be opposed by the flexors of the hip joint. It is very slightly posterior to the knee joint, creating a flexor moment and to be slightly opposed by the extensor muscles of the knee joint, all to maintain an equilibrium of that certain position. In a broken handstand, the line of gravity is located posterior to the wrist joint, which creates an external gravitational moment into extension. This will be opposed by the flexor muscles of the wrist joint. It is slightly posterior to the elbow joint, leading to an extensor moment and to be opposed by the flexors of the elbow. It is very slightly posterior to the shoulder joint, creating an extensor moment and to be opposed by the flexors of the shoulder. It is posterior to the hip joint, creating an extensor moment and to be opposed by the flexors of the hip joint. And it is anterior to the knee joint, creating an extensor moment and to be opposed by the flexor muscles of the knee joint, all to maintain an equilibrium of that certain position. This handstand allows to hold the position for longer for those who don't have great control, as the forward shift of the weight is compensated by the curvature of the spine, preventing from falling forward. In both positions of the handstand, to counter the extensor moment of the wrist joint, there is an eccentric contraction maintained by the wrist and forearm flexors. In a handstand, perturbations are counterbalanced through the wrist, elbow, shoulder, and hip strategies. All of these strategies work to allow the center of gravity to be kept within the base of support. The wrist flexors, together with the finger flexors, maintain balance in a handstand through the wrist recovery strategy for more than 75% of the time. The triceps concentrically contract as the prevailing external moment and will be equally countered by the elbow flexors. The rhomboids, trapezius, and levator scapulae push through the shoulders so there are no gaps between the arms, shoulders, and ears. The serratus anterior contracts to maintain the shoulders in abduction, with greater need of force during a straight handstand since it is also a flexor of the shoulder. The latissimus dorsi eccentrically contract to hold the handstand for an extended position. The abdominal muscles, rectus abdominis, obliques, and transversus abdominis, concentrically contract to posteriorly tilt the pelvis and flatten the lower back. This also helps the extensor moment of the hips, acting on handstand position. This extensor moment of the hips will be balanced out by the psoas major and psoas minor, for they eccentrically contract as the leg rises. For the knee, in a straight handstand, the hamstrings concentrically contract and is equally opposed by the knee extensors, rectus femoris, vastus medialis, vastus lateralis, and vastus intermediate. In a broken handstand, the quadriceps contract concentrically and is equally opposed by the hamstrings. The plantar flexors, gastrocnemius, flexor digitorum longus, flexor hallucis longus, peroneus longus and brevis, plantaris, Soleus and tibialis posterior contract to keep the feet and toes pointed. The cervical extensors, rectus capitis posterior major and minor, obliquus capitis superior, and spinalis capitis also contract to enable a slight tilting of the head so the gymnast can peek over his or her eyebrows to spot the anchor point in between the hands. All of these muscles work to keep the line of gravity within the base of support, thus maintaining balance on a handstand position.